You know that feeling, right? You're sitting in the doctor's office, you're trying to explain what's wrong, but the words just aren't coming out right. It's frustrating, and honestly, it can be a little scary. But what if finding the right words was the first step to feeling better? Well, today, that's what we're going to do. We're going to learn the language of health.
Being lost for words is more than just feeling a bit awkward. It's stressful. You start to worry. Are they taking me seriously? Or are they even getting the full picture of what's going on? And believe me, it's an incredibly common feeling.
But here's the good news. Having the right vocabulary can change everything. So in the next few minutes, we're going to build a little toolkit of precise words that'll help you have a much more confident, much clearer conversation with your doctor. Because it's true, better words really do lead to better care.
Okay, let's start with the most important part, describing your symptoms. Think of it this way. Your body is trying to talk to you, and our job is to be the best possible translator for the doctor.
Just look at the difference here. Saying, "I feel sick," is kind of like handing your doctor a big, tangled knot of yarn. But when you get specific, "I have a fever, chills, and this cough that won't go away," you're giving them a thread to pull. It helps them ask much better questions right from the start.
Let's try another one we've all probably used. My stomach hurts. Okay, it's a starting point, but where does it hurt? What does the pain actually feel like? Is it always there, or does it come and go? Answering these questions helps your doctor zero in on the problem, turning a fuzzy complaint into a specific target.
Having the right words is absolutely crucial, especially when it comes to pain. Is it a sharp, sudden pain, or more of a constant, dull ache? Does it feel like it's throbbing along with your pulse, or is it more of a burning sensation? Using just one of these words can totally change how your doctor understands what you're going through.
Oh, dizzy is a perfect example of why specific words matter so much. Do you feel lightheaded, kind of woozy like you might pass out? That could point to something like blood pressure. Or is it vertigo, where it feels like the whole room is spinning around you? That often suggests a totally different issue, like with your inner ear. The treatments are completely different, so making that one distinction is critical.
All right, so you've done a great job describing your symptoms. Now the conversation kind of shifts, and it's your turn to listen. And understanding the doctor's plan, that's just as important as giving them the right information in the first place.
First up, you'll hear the word diagnosis. Really, all this is the name of the problem. It's the doctor's conclusion based on your symptoms, and everything else in the treatment plan is going to be built on this one word.
And that diagnosis leads to a prescription. This is the how, the action plan. And remember, a prescription isn't just for pills. It can be for physical therapy, a change in your diet, or even an order for more tests. It's the official roadmap to getting you better.
So here's how it all comes together in a real treatment plan. Every single instruction is specific for a reason. With food might be because it helps your body absorb the medicine. Avoid strenuous activity is there to let your body heal properly. And that follow-up, that's a super important safety net. Every step has a purpose.
This brings us to our final and maybe the most powerful section. See, it's not just about talking and listening, it's about asking. This is how you really take charge and become a partner in your own healthcare.
This is a question you should always ask when you get a new prescription. Always. Knowing the common side effects does two things. First, it keeps you from freaking out over a normal reaction. And second, it tells you exactly when you should be concerned and pick up the phone. It's all about being prepared.
I love this question because it's so proactive. Asking what's next before you even leave the office gives you a clear plan B. It just gets rid of all that future anxiety of wondering, well, now what do I do if things aren't getting better? You'll already have the answer.
So let's put it all together. Before you walk out that door, just do a quick mental run-through of this checklist. Do I know what is wrong? Do I know how to fix it? And do I know when and why I need to come back? If you can say yes to all three, that was a successful appointment.
When it comes right down to it, this is the main takeaway. It's not about being a medical expert, it's about being clear. When you use precise words and you ask clear questions, you turn that appointment from a lecture into a real conversation. You're building a partnership with your doctor, and that for sure leads to better results.
So I'll leave you with this question to think about. Based on everything we just covered, what's one specific thing you'll do differently? Maybe you'll use a better word to describe a pain, or maybe you'll remember to ask about side effects. Just making one small change can make a huge difference.